The video Mental Health Behind Bars was very illuminating regarding how this underserved population um, is treated regarding their mental health, and honestly, how they're treated in their community when it comes to their mental health and the disadvantages they have. And I believe that there are many reasons why mental health in the prison systems is relevant to me as a social worker. To me, one of those reasons is, there's a good chance that as a social worker, I might end up working with this population either with my field work or perhaps down the line in a different job. That could definitely be the case. But more than that, it's also just the overlapping in wraparound services for individuals that are needing assistance in the community. We have to make sure that when we get a new client, whatever our setting is in social work, that we never judge a person just by one part of their story. So for example, if we get a client who just got out of being incarcerated and is looking to get connected to sustainable employment and maybe is having a hard time because, they have a felony on their record or something, we definitely can't look at it as just like, oh, well, they're a criminal and like have a bias towards them, because there's so much more to the story that we definitely need to consider and bear in mind. That a lot of times individuals are disadvantaged due to their community and to their environment that just unfortunately does not serve them. And as we saw in the video, many times there was trauma, and of course there was untreated mental illness for many incarcerated individuals. There were people who committed crimes in a manic state and didn't even remember because they were unmedicated and untreated for serious mental illnesses. And as we saw, there's a disadvantage for these individuals who are seeking treatment because the resources just don't exist in some of these communities. Just like was said in this video, there were 12 mental institutions in Chicago, and then they closed six of those. They cut it in half. And due to that, all these individuals who need treatment for their mental illness are now ended up getting picked up by the criminal justice system, which unfortunately isn't the best place really for them to be treated, because it creates this cycle of them getting out and then just going back in because they weren't able to get that treatment. These places are being closed, and then there's no real alternative to go into its place. So it just perpetuates this cycle, unfortunately. And so this is definitely something that we have to bear in mind and consider as a social worker, and connecting individuals to resources that will help break down these barriers that are preventing them from leading fulfilling lives. So it's definitely something that we have to keep in mind as social workers. Thank you.